Working with healthcare consultants is our episode topic. Rejoining us for this episode is Dr. Andrew Agwunobi, a physician and author of a 2019 book published by the ACHE Management Series titled An Insider's Guide to Working with Healthcare Consultants. This episode was recorded in October 2023, at which time Dr. Agwunobi was president of Home Solutions at Humana Incorporated. At the time of this episode's release, he was recently appointed as Chief Executive Officer of UConn Health, a position he previously held from 2014 through 2022. Dr. Agwunobi also served as interim president of the University of Connecticut from July 2021 to February 2022. So let's get started.
Welcome to the BRG Nurse Executive Podcast. BRG is a global consulting firm that helps organizations in disputes and investigations, corporate finance, and performance improvement and advisory. BRG's healthcare performance improvement practice offers multidisciplinary services to healthcare organizations. We focus on implementation with innovative, independent, and data-driven solutions. In the BRG Nurse Executive Podcast, we discuss improving patient care by advancing nursing leadership. For more information about BRG, please visit thinkbrg.com. Now here's your host, Nick Chmielewski.
Andy, welcome back. Thank you so much. Appreciate you joining us again.
It's great to be back. Thank you.
You wrote this book titled An Insider's Guide to Working with Healthcare Consultants. And I heard you speak, I think it was in 2019. You were talking to a bunch of consultants about this in the book, and I've read the book, but I'd like to talk more about this for executives that are thinking about maybe bringing in healthcare consultants. Why'd you write the book?
Yeah, I wrote the book because I was a consultant with BRG, which I thoroughly enjoyed. But before that, I ran hospitals for my whole career. And so I had engaged consultants, and I realized that healthcare organizations often don't get the most out of their consultants, and that there are some simple lessons that I wish I had known when I was the CEO of hospitals that I now could see from the other side, from the consulting side. And I thought it'd be fun to write a little book about it and help people to learn a little bit more from both perspectives.
Yeah, the intended audience originally when you wrote it was for executives that either have or are thinking about bringing consultants in to help them with their issues. When should an executive consider hiring consultants?
Well, it's a great question, and it's a really fundamental one. There's two big reasons to bring in consultants. You don't have enough resources yourself to do it, and or you don't have the right expertise internally to do it. First of all, the executive should only hire consultants when the executive themselves and their leadership team are committed to it. Sometimes people hire consultants for the wrong reasons. They think, I need cover to do X, and so I get a consultant in to give me cover for what I'm trying to do, or other sort of dysfunctional reasons for bringing in consultants. You have to be, as a team, you have to come to the point of saying, we really need consultants. We're committed to it. That's number one. But even beyond that, you have to have a serious problem, a serious enough problem, I think, to want to bring in people from outside the organization in. So one, you assess the seriousness of your problem, or what I call the burning platform. If it's just smoldering, you might not want consultants. You can pour water on it yourself. But if it's burning, and there's a time limitation, you're going to probably need consultants. And then the next question is, do you have the bandwidth to do it yourself? Because if you do, what consultants bring is they're an extension of your team. If you have enough people to do the work yourselves, then you don't have a bandwidth problem. So that would say maybe I don't need consultants. But if everybody on your team and your staff are extremely busy and you have a burning platform, you probably need consultants. The other piece of that is, do you have the expertise? That's another assessment you have to make. Then after that, it costs money to bring in consultants. Do you have the money to do it? It's not always extremely expensive, but depending on how your financials look, it could be a challenge. For example, you might not be able to bring them in this year. It might be next year. But looking at your financing and where you're going to fund that from. And then I would say, finally, making sure that, and this is something people sometimes tend to forget, making sure that, I call it having your boss's support. So even a CEO has a boss, right? CEO's boss is the board, right? And if it's a state organization, the board's boss may be the state. When you're bringing in consultants, making sure that the person you report to is behind that before you start launching down that path, because it's a big commitment.
So there's a lot of different firms that are out there, and they're not all structured the same way, and they all don't all even operate the same way. So I've decided I think I need some consultants.
Right.
How do I select the right consultants? Can you walk me through your recommended selection process from the RFP all the way
Yeah.
through the interview?
So I know that some people listening that might be saying, why do I need an RFP? I know a good consulting firm, or I know a couple of consulting firms worked for me before. And that's true. You don't always need an RFP. But I certainly, at a minimum, would have a choice between a few consulting firms that you make based on some criteria, right? I actually like the RFP process because it enables you to really tease out a lot of detailed information that you don't get when you're just choosing yourself. So, for example, an RFP will tell you how big is the firm, what's their financial strength, so it asks you those, how many people does it have in certain areas, what's the focus of its work, how long has it existed for. So there's a lot of just basic information that comes through in an RFP that's important. And then, of course, you can put your scope of work into the RFP that says, this is what I'm looking for. Apply if you do it. Don't apply if you don't do it. And you can get a lot of background information. Then what I would do is I usually send to no more than 6 to 8 firms, because one of the problems with RFPs is the flip side of the success. And that is, it asks for a lot of information. And sometimes if you don't handle it well, it can prolong the period of time because you're waiting for responses. Then you have to score the responses and things like that. So I would narrow down the number of firms you send to, no more than 6 to 8. You probably want to do six or so, or 6 or 5. Limit the response time to 3 to 4 weeks. Tell them I'm only giving you a month to respond. Limit the questions and the word count so that people don't send you back 50 different pages. And then the other piece of it beyond the RFP is, which is maybe even more important than the RFP, is how you vet those firms. When your RFP slims it down to, let's say, 3 firms or whatever, and you interview those firms, the interview questions are critical. You make sure they establish their qualifications for the job. Lots of firms will apply for every RFP that comes across their desk, whether they do it or not. Get the history of the firm. If it started off as an accounting firm, how did it become a clinical performance improvement firm? Let's start saying, wait a minute, that doesn't sound quite right. Who will be working on my engagement? Sometimes a lot of people make the mistake of saying, I want this group that sold to me, that pitched the sales to me or the engagement to me. I want this group because that's your senior leaders. The problem is those senior leaders may not have done an actual engagement themselves for a long time, but you want to know who's on your engagement. Is it them? Is it someone else? You want to make sure there's no bait and switch there. You want to assess their competence as a firm. How will you approach my organization? How will you perform the work? What's your cultural fit with my organization? And how will you communicate to me during that time? And how flexible are you? There are some consulting firms that are like, this is how we do it. This is our model. And it's been successful, and we continue to do it this way. And then there are other firms that say, this is our base model, but we customize it to your organization. And that's where interviews, RFPs, they're such a critical part, because if you get that wrong, you're going to have a problem as you go down the path of an engagement.
What is the difference between an advisory firm and an implementation firm? And why is it important to know the difference?
Yeah, people like to say, and sometimes they say it in a little bit of a derogatory way, that consultants just come in and they look at your watch and they tell you what time it is. But what good advisory firms do is they come in and they run around your organization. They find the pieces of the watch across your organization. They put it together, and then they tell you what time it is. And usually that time is not the time you thought it was. And that's where implementation firms come in. Implementation firms then pick up from there, and they fix your watch so that it tells the right time. And so if you get a firm that does both, that's great. But you often have advisory firms that only do the advisory part, and then you have to go get an implementation firm to do the implementation. A better approach is to get an implementation firm, because they always do the advisory first. right? They do the assessment before they do the implementation. So that's really what you want to do is seek an implementation firm, unless you're only looking for advice, which sometimes is the case, right? And why the difference is important. Now, of course, BRG is an implementation firm. And why the difference is important is because if you're only giving advice, but you're not on the hook for implementation, you can give a lot of advice, a lot of ideas that may or may not work. But if you're on hook for the implementation of that advice, you're going to be really thoughtful as a firm about what you bring forward. And by the way, good implementation firms, when I say on the hook, they actually go at risk for at least some portion of their payment. So this is real money. This is, if I don't implement this properly with the whole organization, I don't get paid. And in fact, when I was working in implementation, the CFO would have to sign off and the department managers would have to sign off that, yes, you changed the workflow in this department and it led to an improvement in productivity of Y, and it did not negatively impact the quality of the department. You have to sign off, get that signed off before you get paid. So that's a big incentive to do the work properly in terms of the advisory piece of it.
Let's take a step behind the curtain for a moment and gain a greater understanding of the structure, the ranks or titles, and the culture of consulting firms. What are the different types of levels of professionals that I may expect to see on a project? And what exactly do they do?
I realized when I was on the hospital side, I didn't understand when they said, I'm a consultant, I'm a senior consultant, I'm an associate. I didn't really get what that meant, what the difference was. And there was an assumption that I did. And it's important to know. So associates, or sometimes what I call data analysts, these are entry-level individuals straight out of undergraduate programs. They don't have consulting experience. Sometimes they go into consulting because they want to find out what they're really interested in life, right? But they're wonderful. They're great at data. They're paddling in the background, making everything happen from
Wicked
power
smart.
wicked smart. They're
Yeah.
just amazing people. They're the entry level people, right? I think of them in the healthcare world, they're like the med students. They're learning, but they're doing a lot of the work,
Okay.
right? That's in the background. Then you have consultants, managing consultants, senior managing consultants. These are the subject matter experts. These are more like the doctors in healthcare, right? These are the people that know what they're doing in consulting, bring the actual change ideas and implement the ideas. Directors lead those teams of consultants. They're like the most experienced and the most knowledgeable, and they're fantastic. And then you have at the highest level, you have the managing directors. These are the highest rung on the consulting team, and they have two main roles. One is, just putting it bluntly, selling engagements, getting clients, right? In fact, sometimes that's a prerequisite to being a managing director, is that you can do that. But the other is leading engagements and making sure the clients are happy with the engagements and making sure the consulting team is effective and is satisfied with what it's doing and is making progress. And so that's how it all comes together. And one reason it's important is because sometimes small firms that are stretched financially, small consulting firms, will put associates in the places of consultants. So you'll be in a room in a hospital, and the person presenting is a very talented associate. That's okay, but that's not a consultant. That's not a managing consultant. And so you have to be aware of. Now, by the way, I want to say this: there are times when there are amazing associates that we want to get in front of clients, but they shouldn't be leading the consulting engagement for the client. And so knowing who's who is important.
Yeah, it's a good way for them to grow as well, and provided you have someone in the room that's supervising and watching it, it's a win. No different than the
Right.
way you would wanna develop, an assistant nurse manager that you wanna be a manager
Exactly.
and a director or something like that.
Exactly. It's like the med student example I gave. You always want the med student, you want the residents, you want people in there doing what they need to be able to learn, to be able to showcase what they're doing, and to be able to show them that they're valued and that they're not just there working, doing scud work in the background. Their work is valued and they love it. So it's very important to have them in front of clients, but they need to be supervised, and you need to have a consultant there in the room doing some of the more detailed work.
Can you talk a little bit about communicating the engagement? So you've made the decision, you're bringing in firm X, and what does the communication strategy look like?
It's all of this is really close to my heart because it's so important for a successful engagement, no matter what side you're on. communicating the why is probably the most important thing. Why are we even doing something like this? So communicating the burning platform. There's so many times where I've seen where an organization is announcing something like a big consulting engagement, and everybody is like looking at each other and saying, wait a minute, why are we doing this? We seem to be doing pretty well financially. And then you have to communicate why consultants? Why not internally? And this is where you get to this whole idea of bandwidth, resources, expertise, but you always communicate it as the consultants are an extension of leadership and the employees. They're not coming to tell us what to do. They're not doing it for us. They are us, and we're doing it together. And that's really important. But also to be authentic, right? One of the first questions that comes up in people's minds when consulting firms come in is, will I lose my job? And that's there in the back of everyone's mind. So being able to hang a lantern on that and say, we don't know what the opportunities are. We'll evaluate them. We'll get everyone involved. We'll be very transparent. Right now, we're just assessing, and more will come as we go down the road. So not being open and honest about it without causing complete panic as well. And it's honest because you don't know until after the assessment what might happen. And a lot of times it does not include people losing their jobs. And in fact, a lot good consultants will ask the client up front, do you anticipate that would you be behind any loss of jobs or not? And some clients say, we want to do this without any loss of jobs. And if that's the case, you want to say that in the first meeting. You want to say, the plan is that this will not affect jobs. So again, being authentic and transparent. And then the only last thing I would say is branding. Usually you brand the campaign because people want to know what to refer to it as. But don't brand it after the consultants. This is usually about a vision. So it might be something like cost and value campaign or value driving campaign or something like reimagine. Let's say the hospital is St. John's Hospital. Reimagine St. John's, right? That's probably a better one. Something like that where people can feel good about what they're going into.
What's the launch of the engagement? Should that look like?
There's some mundane parts of it. For example, and I put in my book, for example, making sure you have space for your consultants. I don't know about you, but I've been put in basements of
No Wi-Fi.
no Wi-Fi, basements of abandoned buildings. And people don't mean it bad. They're just like, oh, where do we have space? Well, there's
Right.
never space. And so you put them somewhere. But making sure that consultants have the right space so that they can be productive. Think of it. They are extensions of your employees. Where would you put them? So you put your consultants in the right place so that they can be effective. And the closer to your employees and your leaders, the better. So that they can pass them in the corridors, they can eat with them in the cafeteria, they can become part of your team. And then the person who leads the engagement from the consultant side should be partnered with a person who leads the engagement from the so we call it a dyad, from the client side. I always like to do things like the routines are important. Avoid having meetings about the engagement without the consultants. If there's a problem, if one of the department managers is saying, well, these consultants, they don't know what they're talking about, do it in the meeting, right, with the consultants, because this is and do it respectfully, right, in the meeting with the consultants, so they become part of the family. They understand what's going on. They will always put the client first, and so they can understand without the background, the water cooler discussions. And then you have to do kickoff meetings with the whole organization, right? And this is where the healthcare executives come in and the leader from the consultant side. They should be reviewing the decks that are going to be presented together, because that is the first opportunity to have a misstep. If you're presenting as a consulting firm to an organization and they view the presentation as too generic, too much like a sales pitch, too long, too wordy, wrong presentation for this audience, bad presenters, whatever it might be, you start to lose credibility and you haven't even started the engagement. So that's where the teams have to come together, do dry runs, do rehearsals, make sure it's right, and then move forward.
Structure for the engagement. You talked about the dyad. Anything else around the structure of the engagement?
Yeah, I would just say that usually you'd have an executive steering committee. I've seen certain situations where a consulting firm has said, we're going to start the engagement. We're going to touch base with you in 2 months. Then we're going to bring something forward to you a month later. And I'm like, whoa, time out. We need to have an executive steering committee that involves consultant leaders as well as my team leaders on the hospital side or on home health side or whatever I'm doing. And we touch base initially every week or something, and then every 2 weeks, and then we can go to monthly to make sure that everything is on track and that we're helping to support the team to knock away obstacles, etc. And that executive steering committee would have work groups. So it might have a revenue cycle work group, a nursing work group, workforce work group, etc., purchasing and supplies, whatever it is, all these different work groups reporting up to the executive steering committee is really good. Now, one of the complaints that often comes up is there are too many meetings because you got all these work groups meeting, you got all this work meeting. So one thing I advise is that you piggyback those meetings onto existing meetings. For example, if the senior executive team of the health system has every 2 weeks or even every week has a meeting for its senior leaders, you take 20 minutes of that meeting every 2 weeks to be the executive steering committee meeting. And you invite other people to, or 30 minutes of that meeting. It doesn't have to be a long meeting. So that's really important. So yeah, those are things I would advise.
What are some of the common causes that you've seen around engagement failures? And conversely, around successful engagements, and along with that, when they are successful, which hopefully is quite often, how do you ensure sustainability after that consulting firm is moving on to their next engagement?
I think success is really doing all the things we already talked about, making sure that all of those are in place, from a communication to a management of the meeting, to the launch of the meeting, to the selection of the firms. That's really what drives success. What drives failure is stakeholder resistance. And again, if you haven't done the right groundwork and you haven't articulated the right why and et cetera, that's a problem. And if you're not committed as a leader yourself at the beginning, that's a problem. These quickly unravel. Another one that is really a lot of times is the fault of the consultant, but also is shared with the client, and that is analysis paralysis, right? Where there's a never-ending cycle of data collection and analysis. Sometimes when I said the consultant, when it's the consultant's fault, it's due to um, allowing that to happen, right? Where you just keep bringing back more and more data and it keeps spinning. I think what you have to do early on is to state quite clearly that the data is directional. It will never be perfect. If you can get to 70% of perfection or 80%, that's probably enough and you move forward, but not setting the expectation and sometimes it's just because consultants are A-type personalities. They want to be perfect in their data, but the data is never going to be perfect, and setting out that expectation from the beginning is really important. The other thing is wrong initiatives causes problems, and that is a consulting issue. When maybe based on the wrong data, they've chosen an initiative that maybe the juice is not worth the squeeze or something like that. And so making sure, and this is where implementation firms come in. They're going to usually not bring forth an initiative that doesn't move the dial for the client, or is the wrong initiative, is too disruptive. So that's important. And then this is where this last one is where the client and the consultant really need to partner strongly on, although they do on all of them. And that is working across departments. So I mentioned in my book about an example where there was a great initiative. I believe it was a hospitalist initiative, but it needed, and so it was all mapped out. Everything was perfect, but it needed the emergency department physicians to buy into it, and they had not been brought along. And so when they heard it for the first time, even though it was a great initiative, they immediately opposed it. And so working across departments, and that's where the executive steering committee comes in, and people say, wait a minute, did you talk to these people? Did you talk to those people? So that's really critical as well. Now, from a sustainability perspective, I think maybe I'm anticipating your question, but
Yep.
part of being successful is also being sustainable. And I think knowledge, so just for those who are maybe not so steeped in this, when we talk about sustainability, we're talking about the question that always comes up in an engagement, and that is, especially good engagements, how are we going to sustain this going forward? The client asks the question. Consulting firms should be proactive in that and should talk about in their initial interview about how they sustain it. And there are a number of ways. One is knowledge transfer. The experts, the consultants, training the department directors and others in areas that they need training in, whether it's revenue cycle, clinical processes and operations, whatever it might be, educating where they can. That has to be scheduled and has to be very intentional, because the consultants do not have time to be spending all their time training people. So it needs to be scheduled and be very deliberate part of the engagement. The other one is, which I like particularly, is changing policies. So during an engagement, the consulting firm should be working with the client to change policies, because that hardwires the changes that the consultant has brought. So it's not just, let's do it this way, but no, let's find the policy that existed before about how you used to do it, and let's change that policy and throw away the old one, right? And so that's a hardwiring way of doing it. And then the last one, I think, is leaving tools behind. So a lot of times consulting firms will bring data analysis tools that are proprietary, or will bring other tools, revenue cycle tools, and being ready to understand what you're going to leave behind. Sometimes there's a charge for that. Sometimes it's just part of the deal, the engagement. But what are you going to leave behind that people in the organization can continue to use? And then actually I'll add one more, and that is from the client side, is setting up the routines with the client so that when you're gone, the client is continuing something that looks like an executive steering committee, that looks like a work group, and that is adding new initiatives to the ones that the consultants left behind. So you're actually getting even more value as you go forward.
Any closing thoughts as we wrap up this episode?
The more there's change in the world and in the US, the more the consultants are needed. And healthcare in particular is an area that needs consultant expertise. And I'm just happy to see that a firm such as BRG is really interested in mastering the interaction with the clients as we go forward.
Andy, thank you so much for taking the time today to discuss how executives can best work with and leverage healthcare consultants in their organization. That was your original intent of the book, but I think it's also really got two other purposes. And one is, gosh, I'm thinking about going into consulting. What am I getting myself into? Way to read the book then. Or I've just started a job and I'm an associate and I don't know what I got myself into. Maybe I should read the book. The book is titled An Insider's Guide to Working with Healthcare Consultants. It's by Dr. Andrew Agwunobi, available by ACHE Management Series. I found it on Amazon. Andy, thank you so much. Appreciate it again.
Thank you. Great to talk to you.
You've been listening to the BRG Nurse Executive Podcast, which focuses on improving patient care by advancing nursing leadership. The views and opinions expressed in this podcast are those of the host and podcast guest and do not necessarily reflect the opinions, position, or policy of the guest employer, Berkeley Research Group, or their other respective employees and affiliates.